Everyone looks at the ECG, blood pressure, SpO2 and heart rate. But for anaesthetists, we obsess over something far more complex. The capnograph. This waveform can reveal hyperventilation, bronchospasm, cardiac arrest, circuit disconnection, and even whether your tube is in the esophagus. And once you understand capnography, you'll never look at this waveform the same way again. Join us in learning this exciting new topic. This is Mastering Anaesthesia, so let's go.
Hi everyone, welcome back to Mastering Anesthesia. This is part 2 of Capnography. If you have not yet watched part 1, I advise you to watch it. In this second part, we are going to talk about the response time and mainstream versus sidestream analysis. Okay, so what is response time? Response time is the time taken for the monitor to display the readings. Capnography has a delay because carbon dioxide needs to travel from the patient's airway all the way through the sampling tube to the analyzer, and once it is at the analyzer, it needs some time to respond and to compute before being able to show the graph as a display. This is particularly more significant in sidestream analysis. You have the ETT here, sampling tube connected to the HME. You see there is a long distance where the carbon dioxide needs to travel from the ETT patient's airway through this long sampling tube to the analyzer. So all of this contributes to the response time. Response time can be further divided into two different phases. The first is lag time and the second is rise time. They represent different parts of the graph, wherein the lag time is the time taken for gas to reach the analyzer. Rise time is a time for the analyzer to respond to sudden change in signal. Lag time is defined as the time to reach 10% of final value. So if the final value is 40, it is a time to reach 10% of the value, which is 4. So the time taken to reach the value of 4 millimeters of mercury. Rise time is defined as the time to move from value of 10% to about 70 to 90%. Ideal value would be 400 milliseconds or 0.4 seconds. So if we take the final value of 40, it is a time to move from value of 4 to 36 millimeters of mercury of carbon dioxide. Represent this on the graph. We have a graph of instrument response in percentage against time. So you can see the response of 0 to 100%, as well as time on the x-axis. So you have an upward slope. You have 0 to 10%. This represents the lag time. And from 10 to 90%, that is the rise time. Okay, so now let's talk about the analyzers. There are two types of analyzers. We have the sidestream and mainstream analyzers. It is based on where the analyzer is positioned. Sidestream, the analyzer is on the side. It's not in the main airflow. So you have the ETT, HME, and the sampling tube is connected from the HME all the way, bring it to the side to the analyzer. That is why it is called a sidestream. So sidestream analyzers, they consist of a 1.2 millimeters internal diameter tube. It's very, very small. They're lined by Teflon so that the carbon dioxide does not react with the tube. The sample gases are sampled throughout the inspiratory and expiratory at a constant rate of 150 to 200 mils per minute. And this sampling tube, it delivers the gas to the sampling chamber to be analyzed. Now let's see how mainstream analyzer works. As compared to the sidestream, the analyzer is positioned in series with the patient's gas flow. You can see the ETT, and the analyzer is connected directly to the ETT, and a display is shown directly from it once it gets analyzed. So mainstream analyzers, they have the sampling chamber is positioned within the patient's gas stream. And an important note to know here that the mainstream analyzers, they are heated to prevent condensation. They're normally heated to about 41 degrees Celsius. Now, moving on to the advantages and disadvantages of these different analyzers. This is particularly very important in exams, so make sure you know them. So let's talk about the advantages of sidestream analysis. We normally see this in operation theater, where it is particularly simple. The setup, we connect the sampling tube to the patient's HME, and the sampling tube will bring the sample gas all the way to the ventilator, and it is get processed there and displayed on the ventilator. So sidestream analysis, they can be used in intubated patient. Also, another advantage is that they can also be used in non-intubated patient. They also can be used in uncommon positioning of patient. So let's say the patient is in prone or beach chair or lateral. There is no problem in analyzing because there is no bulky structure or additional weight that we add in onto the ETT. There is also minimal dead space in sidestream analysis. Despite the long sampling tube, the dead space contributed compared to mainstream is less. And sidestream analysis, they do not require sterilization between use, so this is very convenient. So in sidestream analysis, there are some disadvantages. They are prone to kink. So when there's kinking, there is a interruption in the reading of our capnography. There is also loss of anesthetic gases due to scavenging. Bernoulli's principle in the sampling tube may show a reduction in PCO2. In sidestream analysis, there can be significant delay time. So this is particularly important where we want very quick response time in cardiopulmonary resuscitation. We want to see rapid response to ROSC, or in bronchospasm, we want to see the pattern of the graph. Also, the tube is relatively more easier to be blocked by secretions or sputum. And also there is dispersion of gases within the sampling chamber. This will contribute to the distortion of the values. Alright, now to the mainstream analysis. The advantages are there's no lag time, they are more portable, and they avoid certain issues particular to the sidestream analysis, wherein they avoid sampling tube issues as well as scavenging issues. The disadvantages of mainstream analysis, because it requires heating and quite to a significant temperature, 41 degrees Celsius, there is risk of burn inflicted on the patient. Mainstream analysis contribute to increase in dead space. They also are quite bulky, and it adds to the weight of the ETT. There is also a risk of the analyzer being completely covered by secretions because the sampling chamber is connected in series with the ETT. So whatever is coming out of the ETT can block or can contaminate the sampling chamber. Mainstream analysis needs to be used in a closed circuit. So in this sense, mainstream analysis can only be used in ventilated patients. And lastly, mainstream analysis, they need to be sterilized between use.
Thank you for watching. If you find these videos helpful, please hit the like and subscribe button to show your support. Comment down below what topic you want us to cover next. Till next time, see you in the next video.